Hi, Dr. Malka here. Today I'm going to discuss how to self-treat arm symptoms of numbness or pain that travel down the back of the arm, into the forearm, and when the trigger point's really bad, it can go into the hand. I've coined this syndrome mouse arm because it presents mainly in the right arm of people who use the computer mouse. The muscles that cause these symptoms are the infraspinatus. It's one of your rotator cuff muscles, and it's not visualized here, but there's a muscle that lays right here called the serratus posterior superior. And when these muscles get tight, it'll create these symptoms that go down into the arm. Proper posture in front of the computer is essential for both preventing and healing from this syndrome. So what you want to do is when you're in front of your computer, drop your arms down in a neutral position, bend your elbows, and wherever your hands end up, that's where you want the keyboard and the mouse. Reaching for the mouse, even a half an inch or an inch over an 8-hour day, or more like a 12-hour day for some people, that can really burn this arm out and cause that pain to go down. In order to stretch these muscles, you want to bring the back of your hands at your lower back, rotating your arms forward and dropping down and relaxing into the stretch. And you can even do this at your desk. And just hold that for 30 seconds. And you should really feel that in that rotator cuff muscle. To strengthen this muscle, bring the elbow into the side, and you're just going to externally rotate the arm like this. And then the other side, the same thing, just externally rotate. If you want to put a little more gravity into it and hold on to some weights and intensify this exercise, you'll want to lay on your side, hold a weight, and once again, externally rotate for about 40 seconds. And then you can come up, put the backs of the hands on the back, bend over, stretch, and release this muscle. And then come back down into the lying position with a weight and just externally rotate. And just keep repeating this for about 5 to 10 minutes. To massage this muscle, let's find it together. I'm going to bring my arm behind my back, and you can see that wing of that scapula sticking out. So bring up the theracane, find the edge of that bone, and just come off it over here and push in using a little torque. You can go back and forth, maybe half an inch strokes. And when you find that trigger point, just hold and stay on it. Take deep breaths for even a couple minutes. Of course, my preference for this is to do it in a lying down position so the muscles are completely relaxed. Then for the serratus posterior superior, find the spine right in the center there. Come over, and again, you can roll your shoulders forward a little bit and just push in, moving back and forth until you find that trigger point. And again, it's not so common in this muscle. You'll most likely find it here rather than here. And the entire border of this muscle is all the way like this, down and up. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available for any questions you have or suggestions for future videos.